Cardiothoracic surgery is very unique.
We really develop a relationship with our residents and fellows.
The program has been phenomenal.
6 of the best years I've ever had. If you want to be in a tight-knit group, Northwell is a great spot for you.
My name is Frank Mineta. I'm the program director for the residencies in cardiothoracic surgery at Northwell Health. We have 2 programs right now. We have an I-6 program, which we take 1 resident, which is usually straight out of medical school.
So that's 6 years of highly specialized training geared towards cardiac and thoracic surgery.
We also have a 2-year program. That program is a traditional fellowship track, whereby you have to have completed 5 years of general surgery before starting the program.
We have both integrated and non-integrated residents, and they work very well together.
The program is unique in many ways. Number one is we are part of a large healthcare system, and the variety of cases and number of cases, I don't think there's any place in the United States that's able to match both of what we have.
This program is just unbelievable in terms of the volume and the variety of cases.
We have one of the busiest cardiac programs in the country. We have one of the busiest thoracic programs in the country. And just seeing the full array of surgeries we could do is what really drew me here.
We get to see pathology that you don't see in other places.
The residents are really seeing and participating in a large variety of minimally invasive procedures.
We see everything from the bread and butter cardiac, coronary disease, valvular disease, to more of the most recent, latest and greatest technology in atrial fibrillation surgery, to more complex aortic surgery and heart and lung transplant. And on the thoracic side, we see lung cancer, esophageal cancer, complex airway disease, complex foregut anatomy.
We do transaortic valve replacements, surgery for heart failure, surgery for atrial fibrillation, robotic surgery.
You know, ECMO is something we do a high volume of here. We have an ECMO to go team where we'll even go out to other hospitals and do the ECMO at a different facility. Residents are very actively involved in this program.
And so the residents really get to see everything. That's very important for training.
We train at a few locations.
One is Long Island Jewish Medical Center, where the thoracic surgery training takes place. The second major campus is at the North Shore University Hospital in Manhasset.
Northwell, which is really our cardiac epicenter, is also a level 1 trauma center, which is supported by our helicopter system and the breadth of the Northwell system. South Shore University Hospital is a cardiothoracic rotation located in eastern Long Island, and residents will get a little more of a hands-on exposure there.
We also spend time at Cohen Children's for our congenital time.
And there is Lenox Hill in the city. And each campus has their own unique personality.
The patient population of the residents encounter is very vast. You will see immigrants who literally just come off a plane with complex cardiothoracic issues to people who are well-established and affluent who come from the Gold Coast of the North Shore.
We're in the middle of New York City and Long Island. So we get a patient population that is so diverse.
We have as broad-based a socioeconomic and cultural group of patients that we are privileged to take care of as anywhere in the world. Queens has more languages spoken than any place else in the country, and probably any place else in the world.
That's not only interesting from a personal standpoint where you get to hear all these stories about all these different people, but it's also very interesting clinically. You get to see diseases that you wouldn't get to see at other institutions just because of where we are geographically.
Our faculty here are wonderful. They all bring a different perspective.
Really, anything that you could think of, we have the experts here.
Some of them are world leaders in what they do for their clinical realms. Some of them are research heavy.
They're very hands-on and they serve as phenomenal mentors.
I know my potential, but there's something that the attendings see that they see beyond our potential.
The mentorship we have from our faculty is lifelong.
I have nothing but praise for the chairman, Dr. Alan Hartman, who, despite the fact that he is as busy as he is, he knows every one of the residents by name. He lets them operate in his OR. He's here to teach.
The residents have experience working with faculty members that are interested in all the aspects of cardiothoracic surgery, and really fun to work with.
We have a lot of hyper-specialized surgeons who are focused in their particular niche. We have one of the busiest robotic thoracic surgeons in the country, Dr. Paul Lee. We have Dr. Zeltzman, who does single incision surgery, was one of the few surgeons in the country, if not world, to do it.
And that doesn't mean that you don't get to do it. You're in the OR with him. He expects you to operate and function like him and will teach you how to do it his way.
As we get more senior in our training, we do get a lot of autonomy to operate with the attending. So, for example, in the complex aortic cases, I get to work with Dr. Brinster, who has one of the highest volumes in the area.
They have the unique experience of working with a lot of different surgeons and learning their different styles, not only in the operating room, but how they interact with patients.
And so being able to see different surgeons do their same procedure in different ways gives us as residents the opportunity to learn new techniques that we can apply later on.
We also have a very strong simulation program. We have the BioSkills program, which is located across the street. It's a dedicated area where the residents train on high fidelity simulation. These models beat, these models bleed.
We are very encouraged to be as involved with robotic training as possible. So that starts in the BioSkills lab that we have. We learn how to use the robot both at the console and also at the bedside.
BioSkills facility is designed by Northwell for the sole purpose of creating an environment that's safe to teach people. It costs a lot of money to do it, but the system is fully behind it.
I chose the program here at Northwell because it's a very clinically heavy program. We do have research opportunities as well.
We have a wide variety of research opportunities.
There's a lot of flexibility in what you want to do and how much you want to do.
We have the Feinstein Institute for Medical Research, which is one of the largest both public and privately funded research facilities in the country. And Dr. Mineta, who is the program director, is very proud to support the residents and the trainees in their research endeavors. We currently offer a 1 to 2 year gap year for research during the residency program.
And I took that opportunity to do 2 years of research in an area that I was very interested in.
I was able to present and attend the International Cardiothoracic meeting in Milan. It was an incredible experience to be able to meet surgeons from abroad and apply some of the things that they do abroad differently here in the United States to our program here.
The culture here is phenomenal. I consider my program and my co-residents as a second family. We look out for not only our own wellness, but also each other's wellness.
The quality of life of the resident is actually quite good. We believe that wellness is very, very important for the resident.
I have actually a great quality of life here. I live in Williamsburg in Brooklyn, and I have a great commute here in the morning. It gets me very easy access to the city whenever I want.
We definitely have time outside of the hospital. We actually, as a group, like to plan outings. What's beautiful about this program and being in an area like Long Island in New York City is that there's something for everyone.
The world is your oyster here because you can enjoy all that Long Island has to offer. You can visit every beach throughout the North Shore and the South Shore and also have quick access to New York City.
I think this is a place where you can have a life, enjoy yourself, enjoy working with the people around you, and learn everything you need to be a cardiothoracic surgeon.
As far as a residency program, I think it's fantastic, and that comes in large part to how close the residents are. And you don't get that everywhere.
Even when it gets stressful, it's a group of residents and a group of attendings that I'm excited to come and work with every day. Our program director always has our back. Dr. Mineta really makes this program, I think, what it is.
It's an exciting time to be a resident and to train in cardiothoracic surgery because there's so many different areas that are available to the cardiothoracic surgeon. They can truly tailor their career to what they want to do based on the training that they receive here.
I know that when I'm done, I'll be ready to tackle anything.
I've been able to explore patient care as an early resident and then be able to explore technical aspects of surgery as a more junior resident and then being able to kind of tie it all together as a more senior resident.
It's a total transformation into a professional. It's how they interact with people. It's how they hold themselves.
Having trained here and now having started my career as a surgeon, I can confidently say that I think this program really sets you up for success. It helped me get the additional fellowship that I had wanted to out of training. I did the exact thing that I was hoping to do, and I've now stayed in the area doing the exact practice I want.
The program's been absolutely incredible. I wanted to become a cardiothoracic surgeon since the beginning of medical school, but I didn't realize the mentorship, the support, and the variety and depth of things that I would see here at Northwell.
The environment here is very special. It's one of the best programs in the country.
You know, I've had such an amazing experience here. I've had surgeons teach me from day one and never stop caring about me, both recognizing my potential and having the resources to reach that potential, that I would like to give it back. And I'd like to be able to have residents in the future feel the same way that I did here.
I think we have one of the greatest jobs in the world. So I think if you want to get trained and learn how to be a surgeon, you want to have research opportunities, and you want to be with residents who truly enjoy being with each other, I don't think you can ask for anything else.